Asian Pacific Health Foundation is a nonprofit organization established 2 decades ago with the mission to advance health and wellness for the vulnerable groups in San Diego County by providing health education and free community health screenings for hepatitis B and C, diabetes, hypertension, cholesterol disorders, osteoporosis, and vision health at community centers. Since its inception, APHF has worked with the Asian American and Asian Pacific Islander community to conduct monthly health screenings throughout San Diego. Many of these areas have high rates of hepatitis B, also known as HBV, especially among immigrants in National City, Linda Vista, and City Heights. Asian Pacific Health Foundation aims to educate providers and communities on hepatitis B to reduce health disparities and improve testing and linkage to care to prevent HBV-related liver disease and cancer. During the 2 decades of operation, APHF established a trusting relationship with API communities and partners while providing HBV screening in the Hepatitis B Prevention Project for Asians and Pacific Islanders from the California Endowment Grant in 2003-2005. APHF also serves on coalitions to work towards a variety of public health goals, like the National Task Force on Hepatitis B, with focus on Asians and Pacific Islander Americans, and Hep B United Coalition. During the COVID-19 pandemic, APHF has collaborated with community organizations to host COVID-19 vaccination outreach in the underserved communities in San Diego. APHF also implemented virtual outreach to continue screening for viral hepatitis. Since 2010, APHF has initiated a project called Hepatitis Free San Diego to reach populations who have higher risk of infection and poor access to care, and to link them to care. The project paved the way for further collaboration with other API organizations. Results of APHF's hepatitis screening projects have been presented at UCSD Research Symposium and have been used to refine APHF's methods for screening and patient education. To date, APHF has screened 5,600 foreign-born persons in San Diego for HBV, with 300 reported positive and 75% successfully referred to medical care and seeking ongoing medical care due to our detected diagnosis.
In 2015 and 2016, APHF conducted 2 3-month cross-sectional studies to assess knowledge about HBV in the API community and to evaluate the effect of patients' knowledge, awareness, socioeconomic status, and access to healthcare on their vaccination status. Based on these findings, we revamped our screening strategies, such as access to individuals' data before the individuals receive consultation. In 2016, APHF developed a pilot program to examine the use of video to supplement educational efforts. The study measured improvement in patients' knowledge after viewing the mode of transmission, vaccination, and treatment. Based on the study, APHF has improved this aspect of our outreach, such as by incorporating live stories to maximize the efficacy of integrated approach to health education. In light of the COVID-19 pandemic, videos that can be streamed or shared online are even more important for promoting health education information, particularly about HBV. While a vaccine exists for HBV, Asian Americans, especially immigrants originating from developing nations, may not have access to services providing HBV immunization, testing, and treatment. Recent anti-Asian violence might be a deterrent to accessing care and treatment among the AAPI community. Although 80% of San Diegans have health insurance, only 67% of individuals screened by APHF had health insurance. 85% of screened individuals earned less than $40,000 per year, and 59% were Asian. About 46% had no immunity against HBV, and 3% had active HBV infection. By providing in-person and virtual outreaches where these individuals can be reached, APHF brings to them every step of the process for ensuring these individuals receive vaccination and treatment, starting from screening, through education and consultation, and to linkage to care.
In this proposed project called Viral Hepatitis Screening and Education, APHF will use an integrated approach to address the compound problem of lack of knowledge and lack of care for chronic hepatitis infection. There are 2 main project goals. First, to reduce the impact of infections by HBV by providing free screening to identify unvaccinated and at-risk individuals. Link those who test positive for viral hepatitis to medical care for treatment. Individuals with limited access to care will be referred to APHS partners for follow-up care. Second, to raise awareness among health professionals and the general public about preventative measures, risk factors, testing, and treatment surrounding HBV infection. The first objective of this study is to test at least 150 individuals for HBV and to provide health education on the disease. To test people in communities of need, HBV testing will be publicized in ethnic newspapers, posted as flyers in community locations, and publicized online through various website organizations. The second objective is to raise awareness about HBV, address misperceptions, decrease stigma, and encourage and facilitate testing and treatment for HBV. At an APHF community outreach, the pre-test on HBV knowledge will be administered to patients before HBV education, and a post-test will be administered at the end of consultation. In addition to our plan for health education at in-person health outreaches, APHF will develop a pilot program based on the Training the Trainer model to reach a larger API community in San Diego. The third objective is to conduct a free educational online seminar for health professionals about updates in hepatitis B screening and treatment. Seminar attendees will be administered online a knowledge assessment survey that includes treatment, the latest guidelines, and socio-demographic questions. Determination of success will be based on the pre and post tests for health professionals, with a change in score being the measure of interest. The metric for success is the average score, and the goal is 90%.
This concludes our presentation on our pilot Train the Trainer program at APHF. Thank you for your time.